This presentation will give information all about paracetamol. Paracetamol, also known as acetaminophen. Paracetamol is a drug used by adults and children used to relieve fever and mild to moderate pain such as headaches, menstrual pain, or body aches. Paracetamol or acetaminophen is available as tablets, syrup, drops, suppositories, and infusion forms. Paracetamol is known to work on the temperature regulation center in the brain to lower body temperature when someone has a fever. In addition, paracetamol can also inhibit the formation of prostaglandins, which are compounds that trigger pain and swelling when there is damage or injury to body tissues. Oral medicine and suppositories. Oral paracetamol or suppositories are generally safe for use by pregnant women. However, you should still consult your doctor about the right dosage for pregnant women. Paracetamol for pregnant women and lactating women. Category B, it belongs to category B. Animal studies have not demonstrated a risk to the fetus, but there are no controlled studies in pregnant women. If paracetamol given infusion form, then it belongs to category C. Animal studies have shown an adverse effect on the fetus, but there have been no controlled studies in pregnant women. Infusion and injection. Paracetamol injection or infusion should only be used if the expected benefit outweighs the risk to the fetus. Paracetamol can be absorbed into breast milk, but in very small amounts. This medicine is safe for use by breastfeeding mothers as long as it is used according to the rules of use. Precautions before using paracetamol. Do not use paracetamol if you are allergic to this drug. Tell your doctor about any history of allergies you have. Consult your doctor about using paracetamol if you have liver disease such as cirrhosis or hepatitis, kidney disease, or alcohol addiction. Some paracetamol syrup products may contain aspartame. Pay attention to the content of paracetamol products that will be consumed, especially if you have diabetes or phenylketonuria. Consult your doctor first about using paracetamol before you give paracetamol to children under 2 years old. Consult your doctor about using paracetamol if you are taking supplements, herbal products, or certain medications to anticipate interactions between drugs. Consult with your doctor about taking fever reducing and pain relieving drugs such as paracetamol if you are pregnant, breastfeeding, or planning a pregnancy. Immediately see a doctor if you have an allergic drug reaction, serious side effects, or an overdose after using paracetamol. Dosage. For adults, paracetamol can be taken 500 mg to 1 1000 mg given every 4 to 6 hours. The maximum dose is 4000 mg per day. For infants until 12 months, it can be given as 120 mg. For children until 5 years, the dose should be 240 mg. In children, oral paracetamol can be given every 4 to 6 hours. Suppositories and enemas rectally given. Adults and children greater than 17 years uh, can be dosed for paracetamol 500 mg to 1000 mg. For infants 2 to 3 months, the dose will be 60 mg. For infants greater 3 from between 3 to 11 months, the dose will be 60 to 120 mg. Paracetamol suppositories or enemas can be given every 4 to 6 hours. Infusion or injection intravenous. The dose of paracetamol infusion will be determined by the doctor based on the patient's age, weight, and condition. Paracetamol interaction with other drugs. Paracetamol can cause interactions when used with other drugs. Here are some interactions that can occur. Decreased absorption of paracetamol when used with cholestyramine. Increased risk of side effects of paracetamol when taken with metoclopramide, domperidone, probenecid, or isoniazid. Increased risk of bleeding when used with warfarin, especially with long-term use of paracetamol. Increased risk of liver damage when used with barbiturate drugs such as phenobarbital. Decreased effectiveness of the drug lamotrigine in preventing seizures. Increased levels of chloramphenicol or busulfan in the blood therapy, increasing the risk of side effects. In addition, the use of paracetamol together with the consumption of alcoholic beverages can increase the risk of liver damage. Paracetamol side effects and dangers. Excessive use of paracetamol, the following side effects may appear. Upper right abdomen hurts, dark urine, pale or grayish stools, loss of appetite, unusual fatigue, jaundice. Stop taking paracetamol and see doctor if you experience the side effects above. Thank you for watching this presentation.